Hello everyone, welcome to Niman's Digital Academy. I am Dr. Sumit, Senior Resident in Niman's Digital Academy. Today, didactic is how to take a psychiatric history. As you know, unlike any other medical illness where there are good investigations to come to a diagnosis, in psychiatry, we don't have such diagnostic tools by which we can come to a diagnosis. So taking an appropriate history is a very important component in psychiatric history in psychiatry to come to a reliable diagnosis so that we can plan the management according to it. The basic steps that are involved in psychiatric history are this is the format in which we need to record the history. First, identifying data, then going to chief complaints, then history of present illness, then past history, family history, personal history, and pre-morbid personality. So today in this didactic, I will be discussing about the subheadings under each of these components of history taking. Now coming to the identifying data, these are the things you need to document while taking identification data. These include age, sex. As much as possible, avoid telling the name of the client. Here when you are presenting, you can use something like Mr. Yes, Mr. A, like that. Then document the person's education, occupation, marital status, socio-economic status, residence. Then you need to document with whom the information is obtained from the history. Like who is giving the history. And in psychiatric disorders, either the patient may be giving the history or the attender may be giving the history. So it is important to check the reliability of this information. So how do you check the reliability of this information? So first, record the source of information, relationship of the informant with the patient, and what is the length of acquaintance with the patient. So only the person who has been closely observing the patient can give a reliable history. So that is a test for reliability. Then you should tell whether you have got adequate information to come to a diagnosis or not. Supposing if there is some additional information yet to come, the patient has been got and the parents are not yet come, so some additional information is likely to come, then we will make a provisional diagnosis. Supposing if no additional information is likely to come, a person lying on the road has been got by the police, they don't know much about him, so no additional information is likely to come, then we'll make it as a tentative diagnosis. Then record the chief complaints. The important points in recording the chief complaints are record in the patient's own words. So to elicit this response, you can ask, what brings you here today? The responses can be, for example, I'm having thoughts of wanting to harm myself. So some of the chief complaints indicate directly to some diagnosis. So this may be something related to depression, or it can occur in even psychosis spectrum disorders. People may say, people are trying to drive me insane. Here probably this is something related to some psychotic phenomenon the person is experiencing, pointing towards some psychotic spectrum disorders. Then coming to history of present illness. So here you need to document what is the onset of symptoms and what is the course this illness has been following over a period of time. What is the duration of these symptoms present? Are there any precipitating factors? And are there any current stressors in the patient's life? Onset can be, some psychiatric disorders can start suddenly. Yesterday the patient was well and today he has become ill. Maybe there are some precipitating events or not. So that is called acute onset. Or in some patients, the history can be like the person became ill over a period of time. There were some changes in him, but they were not impairing in his much day-to-day activities or functioning. But we noticed some changes and that increased over a period of time, leading to the current manifestation. So that becomes an insidious onset. And what is course? What is like how this illness behaves over a period of time? For example, a person has an onset of psychiatric illness. He has come to an hospital, he has got admitted, and then he's free of symptoms now. And then he goes back to his life and starts functioning again. And he's functioning as like before. So that means to say this person has reached a pre-morbid level of functioning. So that is called an episodic course wherein the person reaches the premorbid level of functioning, usually seen in mood disorders like bipolar disorder, depressive disorders, and some illness may follow a continuous pattern, meaning to say the person has an onset of psychiatric illness, and then he receives treatment. But yet, even after treatment, the person has not reached his premorbid level of functioning. So here it becomes a continuous course. In history of present illness, what we want to know is why did this patient present with this set of symptoms at this point of time? So here we have to document the chronological order of unfolding of events leading to the patient's current condition. So you will note down this chronological order of symptoms. And then we want to know what is the impact of these symptoms on the person's life. So here we can assess on various domains, like what is the effect of these symptoms on patient's biological pattern. So what are the changes in sleep, appetite, with libido, or how has these symptoms affected the patient's work life, home life, interpersonal relationships, socialization, and personal care. So here, after recording the chronological order of symptoms, then and elaborating on them, then what is the impact of these symptoms? Here we'll document. Relevant negative history should be taken. These details needs to be routinely inquired into to rule out organic etiology. These include, we should ask history of trauma, fever, headache, vomiting, confusion, disorientation, and memory disturbances, and history of any physical illness like hypertension, diabetes, or history of any substance use. So regardless of the nature of the presentation, you have to ask for appropriate negative history to rule out any organic etiology or to differentiate it from other similarly presenting disorders. So that's why negative history becomes important. So that is about history of present illness. And then we want to know some past history of this person. In past history, I'll divide it into past psychiatric history and past medical history. So in past psychiatric history, the patient may have come to you for follow-up. So we want to know what treatment he has received in the past, what are the drugs he has been tried on, and what is the response to them. Did the person experience any side effects because of those medications? How was the compliance with medications, whether the patient was adhering to medications or not? So these things needs to be documented. And in past medical history, ask for other comorbid medical illness and other medications the patient is on, because some medical disorders or some medical conditions can mimic psychiatric symptoms. For example, hypothyroidism may present with depressive symptoms, and hyperthyroidism may present with some anxiety-related symptoms, or even some diseases like Cushing's disease, Addison disease can present with mood symptoms. So some medical conditions can mimic a psychiatric disorder, and as well as patients having mental illness are at a greater risk of developing medical disorders. And also, if the patient has any other medical condition, we need to check what medications the patient is receiving for that condition, because there are chances of drug interaction. For example, the patient may have acute renal failure or some chronic renal disease. So certain drugs, like for example, lithium can be avoided for mood disorder if the person has. Or we need to look at even the drug interactions that are likely to occur. For example, the patient is taking oral contraceptive pills, and I give a drug like carbamazepine for mood disorder, which is an enzyme inducer which decreases the efficacy of the oral contraceptive pills. So these drug interactions are likely to occur. That's why it's important to document a detailed the comorbid medical illness and the medications the patient is on.